Hello, my name is Tiffany, and my research is on peritoneal dialysis and pregnancy. The research on the effectiveness and outcome of an individual on PD dialysis who is pregnant is important because after thorough research, the reader should be able to gather enough supporting information and studies that will either give hope or doom. This research is important to me on a personal basis because I am a PD patient and I am wanting to conceive. And this research will give me the foundational information, risk, and average outcomes, that will allow me and others in the same position to weigh the results. Pretty much in this introduction, I'm just giving information in depth on the variables that I'll be using to conduct this research, which is basically talking about the different things and aspects that will help in the conception process for an individual that's on dialysis. Um, Moreover, I'll be discussing the different levels that are being watched, the different treatment regimens, the different supplements that will help health wise for the patient as well as the baby, and different things in that order. The most important part of a woman's life that makes her feel complete as a woman is motherhood. Having a child is one of the most exciting additions and experiences in life, and it is a miracle that is an eager expectation of a woman as a whole, and it is a life-changing experience. So with my condition, being that I've been on dialysis for 18 years, it's a very passionate situation and issue for me, and that's the reason why I chose this to research. In my background, in review of the articles provided, the PD patients were able to maintain good numbers due to consistent and constant monitoring of your levels, the treatment regimen, and that is on a person to person basis. And that is measured on how a person is able to release the poisons and toxins with whatever prescription has been prescribed for that individual. And that's monitored and based off of different types of blood tests. Also, in the supplements that will sustain the numbers needed to keep her and the baby as healthy as possible because this is a high risk pregnancy. As long as the PD patient is monitored and closely assessed, laboratory values are kept in healthy range, adequacy of dialysis is being carefully watched so that the regimen can be tweaked or, whenever needed to accomplish good and stable clearances, along with any residual renal function. A healthy pregnancy is possible and probable these times. So many technological changes have been made that can help assist a woman with pregnancy that has ESRD, and that is end stage renal disease. And so that has really become a happiness for those that feel like their life were doomed when they have to become a dialysis patient. It is my determination, interest, and focus to hone in on women on PD dialysis and to do detailed research on the conception, possible complications, regimens, and treatments, and lab levels to maintain and sustain good health for the mother and the child in the high risk pregnancy. My method was inclusive with the use of logistic regression because the relationship between the categorical dependent variable and one or more independent variables are estimated by measuring the relationship and probability, which predicts the probability of certain outcomes. That's measured on complications and different type of things like that. High blood pressure is already one of the most common things that pregnant women carry, so it's very closely monitored anyway. But with a high risk pregnancy, a patient is to see the doctor at least once a week from the beginning to the end. When in a regular pregnancy, it would be like once a month up until the second and third trimester is when they start putting in extra days per week. My variables are this as follows. The dependent variable is the success or doom of being pregnant on PD dialysis. Is it worth the possible complications? And my independent variables is maintaining good clearance to prevent toxicity for you and the unborn child, good lab levels, stress due to such challenge, complications, obtaining a good treatment regimen that will keep the mother and the child healthy, and receiving EPO treatments to sustain blood levels, etc. According to Jean Holly, the percentage of surviving infants born to women on dialysis has improved since the 1980s, when 20 to 23% of infants survive. Let's go to the table because it will show you half of the infants born to women on dialysis. As I said, it has improved. The survival rate has improved. And let's just look at that. Okay, these are the charts, and they kind of give you a closer look of the things that are measured and the ranges that it should be in order to keep the patient at a good, stable pregnancy. And constantly watching these numbers to make sure that whatever's needed to be given to maintain these numbers that is given in the amount that that patient is needing. Give you time to look at that. See, we have the dialyzer. There are certain dialyzers that are used. And in PD, they have two forms. You can do it on machine or you can do manuals, which you will do 5 to 6 times a day is what I do. Now, of course, that is based on a person-to-person situation. Um, Patients on PD or on dialysis are usually have issues with anemia, so they really closely watch the hemoglobin and hematocrit. And of course, they're looking at the nutrition because the baby is pulling from the mother. So she's having to almost do double or triple what she needs nutrition wise in order to maintain good health for her and the unborn child. And at the bottom is just talking about the hemodynamics, the blood pressure, as I spoke earlier, monitoring the fetus to make sure they're growing at the proper speed and that everything is being developed properly and in the correct timing. So it's a lot of things that they're watching closely to make sure that everything is kept within the right and proper ranges. And here's another chart showing pregnancy and dialysis. And it's talking about, it's giving you the year and it's kind of giving you an outlook on different pregnancies, the amount of women that conceived, the incidence percentages in the pregnancy, the surviving infants percentage, the neonatal deaths percentage, and the spontaneous abortions, which are miscarriages. And then it shows the duration and complications of pregnancy in women on hemodialysis. Okay. This is just my research model with the hypothesis, and it's showing my independent variable, which is conception on PD, and then it's giving you all of my independent variables, which are the complications, the treatment regimen, the consumption of supplements, and maintaining good lab levels. And here are my references. I would like to thank you for listening to my presentation, which is very personal and close to me. Um, I let you in on something that is very, very near and dear to my heart, and I hope that it touches you and that it informs you that maybe you can help someone else with this information. God bless. I've enjoyed the class. Thank you, Dr. McLeod, and you all have a good summer.